Hi, I'm Dr. Samantha. I'm a board-certified psychiatric nurse practitioner with over 13 years nursing experience, working in mother-baby postpartum, NICU, antepartum, and labor and delivery. I'm also an IBCLC, I'm perinatal mental health certified, and maternal newborn nursing certified. Ureaplasma is a bacteria that can cause multiple pregnancy complications and can lead to serious illness for your baby. Today we'll be talking about everything you need to know about ureaplasma so you can keep yourself and your baby safe. So click those like and subscribe buttons and stay with us. Ureaplasma is a bacteria called a mycoplasma. It's really small. It is a normal part of the vaginal flora that you have. Those are the bacteria that normally live in your vagina, and most people have it. But it has a very unique cell structure that makes it antibiotic resistant. And if there is too much of ureaplasma, this can cause issues. About 40 to 80% of women will be asymptomatic. That means they have no symptoms of a ureaplasma infection. And just so you know, men can get a ureaplasma infection as well. Symptoms of a ureaplasma infection include the following. For starters, you will probably have pain, discharge, or itching in your vagina. You might also have something called urethritis. This is inflammation of the urethra. This is the little tube that goes from the outside up into your bladder. You might also have abdominal pain, and you might have pain during urination. This pain usually seems like a burning sensation, so it's oftentimes mistaken for a urinary tract infection. And finally, usually with a ureaplasma infection, you'll have a very bad smell coming from your vagina. There are other health issues associated with ureaplasma infection. This includes prostatitis, which is inflammation of the prostate gland in men, endometriitis, which is inflammation of the endometrium, which is the lining of the uterus, and kidney stones. Please remember to hit the like and subscribe buttons so you can get our latest content. If you have a ureaplasma infection during your pregnancy, your baby can also become infected. This can lead to premature rupture of membranes, which is where your water breaks early, miscarriage, preterm birth, and stillbirth. Premature babies are more prone to developing a ureaplasma infection. This means after birth, they can have many complications, including pneumonia, meningitis, a brain injury, lung injury, or breathing problems. To diagnose a ureaplasma infection, we need to take a sterile swab. This is either from your vagina, your uterus, or your urine, depending on what infection we are suspecting. We use antibiotics to treat this infection. Again, it depends on the location of the ureaplasma, how we're going to go ahead and treat it. Newborns who have a ureaplasma infection at birth are treated with different medications for their lung infections. Premature rupture of membranes will use a specific type of antibiotics called a macrolide. And treatment during pregnancy will help reduce the risk of your baby developing an infection after birth. To prevent a ureaplasma infection requires good health. This keeps the colonization of the bacteria in check and doesn't allow overgrowth. If you do have a ureaplasma infection, both partners need to get tested and treated. You must take all of the antibiotics as prescribed to avoid antibiotic resistance, which leads to inadequate treatment. While you're being treated, you need to avoid having sex with your infected partner. Finally, if you are having recurrent miscarriage or fertility issues, you want to ask about being tested for ureaplasma infection. I hope this video has helped you learn everything you need to know about ureaplasma and how to keep you and your baby safe with treatment. Please share your comments and let us know what topics you would like to hear more about. Remember to hit the like and subscribe button so you can get our latest information in pregnancy, labor, and early childhood parenting. Share this video with your friends and family and follow us on Facebook, Instagram, and Twitter for additional content. We will link those in the description below. Thank you so much for joining us at the Maternity Mentor.